It can be pretty tough.
A lot of things to consider when it comes to, pregnancy. And that's why we have Dr. Adedayo Sobamowo. He's a Nigerian third-generation medical doctor and healthcare management consultant. He has over 17 years of international healthcare business experience, and he's executed numerous innovative healthcare infrastructure projects and financing solutions. So today we're talking about tourism options for pregnancy and IVF. Good morning, doctor. So we're asking about the different options people have when it comes to childbirth and fertility treatment abroad.
Okay. So are you talking about different countries?
Yes, different countries, different options, yes.
Oh, okay. So let's start by what's the motivation to give birth abroad. So for a lot of Nigerian women, it's really so that the child can have a second passport. So obviously, top of the list is the US. But having said that, there are a lot of other countries who also grant children citizenship due to birth, but I would say a lot of Nigerians don't know about it, and I'll give a few examples. So one example is Brazil. The Brazilian passport is a very strong passport. I mean, it's visa-free entry to over 100 countries. If you have your child in Brazil, the child automatically is entitled to citizenship. And then for some other countries, there's citizenship at birth, but it comes with some caveats, and most of them, the child has to sort of live in the country for a few years before the citizenship is granted. So that's the UK, and a country like France also falls under that category. And of course, there's Canada. So Canada, like the US, if you give birth to your child, the child automatically is entitled to be a citizen.
Oh, wow. Okay, so which are the ones that you have had to manage the most frequently? So where are the places that people want to go the most?
It's the US. I mean, it's the US.
Hands down.
There's no question about that.
But do you often advise against it or for it?
So the truth about it is, I don't give you blanket advice. I take it on a case-by-case basis. So, for example, some women are not fit to travel for different reasons. So I'll give you an example. My own sister wanted to give birth to a child in America last year. Well, guess what? About 2 weeks before she was scheduled to leave, she developed a very high blood pressure. Okay. Now, for some women, ordinarily, they don't have high blood pressure, but due to the strain of pregnancy, the blood pressure becomes elevated. It's called gestational hypertension. So obviously, she just couldn't go because, I mean, you have to weigh the risk with the benefit. So yes, you want to have a kid in America, but what's the downside? You drop dead in the plane. So it was a no-brainer. We just told her not to go.
So, we have run fast, spent on time, but we really still need to talk a bit more about this. I would love it if we could talk a little further on fertility treatments and opportunities abroad.
Do we have time maybe after the break?
Yeah, I'm hoping, hopefully we'll be able to take a little bit more after this quick break. All right, thank you so much for staying tuned. We have been having a conversation with Dr. Sobamowo on the line. He's still on the line with us, I believe.
Yeah.
Good morning, doctor.
Yes.
All right.
Yeah, so
Good morning.
We were talking about the fertility treatments themselves. It's one of the reasons why people would like to travel either to Europe or America or even the Middle East nowadays. And so usually what would you recommend for people who want to do fertility treatments, especially after trying maybe for a while in Nigeria?
Okay, so regards fertility, I'm going to be quite objective about this. So even though, yes, I'm in the medical tourism business and I make money by sort of referring people to go abroad for care, but in terms of IVF, Nigeria has made tremendous progress, I'll say over the past 10 years. We have world-class fertility centers here in Nigeria. I won't mention them for obvious reasons. But in terms of the quality of care, I can tell you for free that it's the same quality of IVF care you get in Nigeria compared to what you get anywhere in the world. But having said that, so availability of infrastructure is not the only motivator for people to go abroad for any kind of healthcare. For some people, they want to combine healthcare with some sort of vacation or holiday. For some people, it's for privacy reasons. So if I stay in a clinic in Abuja or in Lagos, somebody might see me, especially if I'm a high-profile person, or I'm a senator, I'm a pastor of a big church. So for privacy reasons, yes, you might want to go abroad. So just to summarize what I'm saying, if your motivation is solely on quality of IVF care, doing it in Nigeria is fine, but you need to sort of do your due diligence because there are over 1,000 IVF centers in Nigeria. A lot of them are just jokers because whoever it is running the center doesn't have that specialist training and experience in vitro fertilization. But there are a couple of centers, major Nigerian cities, Lagos, Abuja, Port Harcourt. You go to them, you'll be fine. But if your motivation is you also want to combine it with a holiday, or you just want to change the environment, or, like I said, you're a high-profile person, you care a lot about your privacy, then by all means, you can do the IVF abroad.
Okay. What about differences in cost? Because we've heard so many different price ranges for IVF, and they're almost always so high. Is it cheaper or more affordable to do it in Nigeria or abroad?
So it's cheaper. It's cheaper to do it in Nigeria. Okay. And I also need to sort of speak to the experience if you do IVF abroad. So IVF, it's not like the normal, the average, or typical kind of medical care. So it's done in stages. So, for example, if you were going abroad for IVF care, when you get to the hospital, they're going to do a number of baseline tests for both partners, the man and the woman. They're basically trying to determine basically if you're both fit or who sort of has issue with fertility. So a lot of times you really don't know. Even though in Africa, you just assume it's the woman. So sometimes it's the man. They're going to go through a lot of testing just to sort of determine fertility levels. And then after that, they will now be, for example, if it's the woman, she will now need to be stimulated. She's going to be on all kinds of fertility drugs and hormones. And then it's following that, that the embryo, which is the undeveloped baby, is now planted in. So it's a long process, and most times, except you basically live abroad or you are ready to stay abroad for a long period of time, it could take a couple of trips, for each of these processes. So if you're talking about cost, you should also factor in the cost of accommodation.
Wow.
And also the cost of travel. Just don't look at it as blanket cost, which is the cost of the procedure.
Okay.
So more often than not, it's cheaper to do it in Nigeria.
Wow. Now talk to us about planning. I mean, you are in that medical tourism space, and so if somebody approaches you, maybe a couple they approach you, and they're thinking of doing medical tourism, say in 2021, what would you recommend, and what would be your advice to them in the area of planning and then making the final decision on which country to go?
I'm struggling to hear you. I didn't get that question.
Okay, I said, talk to us about planning for such trips, especially if you're going abroad and you're planning and you're trying to make a decision. So a couple approaches you. What would be your advice to them in the area of planning and preparing to travel?
So for the planning, obviously, you need to have a budget as to what the whole experience would cost. So I would say, speak to a professional who will be able to give you sort of end-to-end service. And by that, I mean, can give you a quote as to what the medical treatment is. You depending on your destination, we give you a quote on what the cost of traveling, so air tickets, and then of course, cost of accommodation. So I personally wouldn't recommend staying in a hotel if you're going to stay for such a long time. So I would say either get an apartment or like an Airbnb. I mean, that definitely works out cheaper. And then, of course, there are also a lot of factors to consider. So, for example, if you speak to a fertility doctor, he's going to tell you, for example, to come in at a particular time. So, for example, he might say, come in when you're ovulating. So you can't just show up, for testing, depending on what test he wants to do. So you have to be clear in your calendar to know so this is for the woman, obviously. You need to be clear on your calendar at what time of your menstrual cycle the doctor is going to ask you to come. So it's very, very specific with regards to timing. So obviously, your schedule has to be free. I mean, whether it's your work schedule or your other commitments, you need to know how exactly you're going to free up that time to go. And of course, there are visa issues depending on where you want to go. And like I said, because it's going to take such a long time. So, for example, if you want to go to Europe, I think your normal visiting Schengen visa definitely won't be enough. So, my advice is to apply for a medical visa. So, medical visas have two advantages. One is you have a longer tenure, obviously, because the consulate or embassy knows that the medical treatment is going to take a while. The second benefit is, so for example, I'll give you an example of a patient of mine who went to Turkey for treatment. So he got a medical visa for 1 month. But guess what? By the time he got there, the treatment was going to take close to a year. But what happened was, immediately that 1 month visa expired, the hospital just helped him to apply at the foreign office there. He was given a 1-year visa. But guess what? If he had gone on like a 1 month visitor's visa, which expired, so even though he was there for medical reasons and he had proof, but there will be a penalty for overstaying, and he could even be banned from coming back into the country. So it's very, very important the kind of visa you sort of apply for when you're going for a long-term medical treatment. IVF, like I said, it's not a short treatment, so our advice, either a medical visa or if you have a long-term tourist visa, for example, you have a 1-year tourist visa, then that's fine. So are the professional considerations I would advise the patient on if you were sort of thinking of going abroad for IVF treatment.
All right.
It's quite a lot to take in, and it's a long conversation, it looks like.
Very long conversation and a lot of intricate details. Just to wrap up, for those who feel that they can just travel and go abroad without having a consultant involved, you're advising that they get someone to manage this whole process for them. Am I right?
Yes. Yes, it's very, very important because, I mean, a lot of people think they can do it on their own. I mean, if you go on the internet and Google IVF centers, for example, in India or in America or in England, I mean, you're going to see literally hundreds of thousands of centers. And like anywhere in the world, you have good centers, you have bad centers. So if you're just basing your decision based on how fancy the website looks or how pretty
that's a problem.
The doctor that's going to treat you is, then you might actually be at risk for sort of getting bad treatment. So the advantage of working with a facilitator, for example, someone like myself is, I mean, I've been to all these centers, so I have a policy. I will never work with a hospital that I've never been to. So for example, last November,
Doctor, I'm
Germany.
so sorry. I have to stop you there. We've run far on time, but it's always a pleasure talking to you, and we appreciate your input on this particular matter. We'll definitely have to talk more about it, and hopefully if you have questions about this, you can visit our social media pages and use the hashtag WakeUpNigeria on TVC and make your comments, ask your questions, and give your contributions. Thank you so much. Doctor.
All right, quite an interesting conversation there, and we have to take a quick break and be back with the third hour of the show. Stay with us.